ReachHealth is a reproductive health organization based in Puerto Princesa, Palawan. We started the organization 13 years ago, and our main focal points are trying to reduce unplanned pregnancy, especially unplanned teen pregnancy, and trying to reduce HIV incidence. And we do our work primarily with a three-pronged approach, which includes providing direct clinical services to women and young people, providing education on sexuality and health, as well as system strengthening work in which we work with our stakeholder partners in order to improve their information and knowledge and approach to sexual and reproductive health, and in particular adolescent sexual and reproductive health.
So what we did was we compiled the data of teenage pregnancies, contraceptive users by age, and what that allowed us to do was to have a common understanding and some shared foundation from which to talk about the situation. So one of the things that I think worked well in the BHC Revamp was bringing in data into the conversation. What it helped do was depersonalize the situation. So we were looking at numbers and discussing situations.
In our FGD sessions, we began our discussion by presenting the data, the teen pregnancy and teen acceptors data, and from there we asked the group what are the factors that influence these figures. Some of the mentioned factors are lack of knowledge among youth, hesitancy, and lack of supplies. So after that, understanding the problem, through utilizing the data, we collaboratively formulate long-term and short-term solutions.
Sa ngayon po, yung situation po namin dito, lalo na po dito sa aming health center, mataas po yung aming current user ng pills at the same time po DMPA. Sa ngayon nga po ay nakakaubusan po kami ng gamot dahil po sa karamihan po na gumagamit po nito. May partnership kasi po ang City Popcom po kay Ugat ng Kalusugan. So yung po mga kakulangan namin, doon po namin hinihingi. Sa referral system din po, kapag wala na po dito, tumatawag po ako kay ReachHealth. At hindi lang po naman yung sa DMPA, pati mga po sa implant at pati po sa IUD.
The solutions labs were really instrumental in helping us figure out what potential solutions we could potentially use. Just because they were so structured, and each week we would focus on a different aspect of the situation. Sometimes it would be environment, sometimes it would be what could potential solutions be, other times kind of challenges. And yeah, it was just really good to get an interesting bunch of people together looking at the issues and the problems from different perspectives.
It's really important that we can actually show barangay health workers and the nurses and the midwives, show them that they can be part of the solution. It's really been very important to work with these health workers to help them to see that in order to improve the situation and help empower young people, they really need to reduce their own judgments of the situation, whatever their own personal feelings might be, and make sure that young people are able to access the services that they need.
Dati po kasi parang hindi pa naisip na maging youth-friendly ang aming barangay dahil meron ngang discrimination, marites na tinatawag ng karamihan. Ngayon na ginagawa ito na maging youth-friendly ang aming barangay, which is napaka magaan sa loob dahil natutupad na yung hangarin ng aming barangay.
Konting paghihirap lang po doon sa aming mga teenagers. Kasi po kung minsan, kailangan po talagang ipaliwanag mo sa kanila kung ano po yung kahalagahan ng family planning para makumbinsi sila. So yung mga kabataan po, hindi po nagdadalawang isip na pumunta dito dahil nakikita naman po nila na yung mga health workers po dito, isa na rin po ako doon, nakikita nila na approachable po kami. Madali kaming kausapin kung anong mga needs nila.
Naintindihan natin kung paano, kumbaga, na mas naging knowledgeable tayo kung paano natin ma-approach na maayos yung mga mother o yung mga babae para maintindihan nila kung gaano kahalaga yung ating mga family planning na binibigay. We conduct mga ISC during our prenatal at saka sa immunization day para kapagbigay kami ng mga flyers like this para mabasa nila at maintindihan nila. Ang kailangan hindi kung paano mo sila i-approach ng malumanay para mahikayat mo rin sila. And we have our adolescent facility para po mabigyan sila ng privacy, maibigay nila ang kanilang saloobin ng maayos at mabigyan natin sila ng counseling o tamang pagpapayo para sa kinabukasan din nila.
The idea that young people should be treated with respect and have confidentiality and not be judged for their actions is not the norm in the Philippines. So changing that kind of perception and that behavior definitely takes time and it takes conversations. And I think the more people that are on board with that and the more other people see, oh yes, this is something that is valuable and this is why it's valuable, the more chance there is of kind of making progress.